Well, hey, good evening, everyone. My name is Dr. Kyle Wallner, and this is the broadcast for the Myasthenia Gravis of Michigan, Foundation of Michigan, broadcast of chiropractic and what you need to know. Everything about myasthenia gravis as it relates to chiropractic care and how simple and effective and sustainable solutions can lead to a healthier lifestyle with myasthenia gravis. And so chiropractic plays a huge role in that. I want to welcome you guys to the live video here. I see some people are jumping on, which was great. I'm going to kind of pause here and just kind of delay, if you will, for a few moments. If you guys want to go ahead and like this video, share it as well if you're so inclined. And if you want to put in the comments, give us a thumbs up. Tell us where you're listening from, whether you're in Michigan or whether you're out of state somewhere, maybe looking to learn more about myasthenia gravis and more about chiropractic care, how the two are interconnected, if you will. And I hope you guys can hear me okay. I hope the audio and the video is going well here. So feel free to let us know about that. Also, please feel free to let us know if you have any questions, comments, or concerns during tonight's presentation. If you have any questions that come to mind, please feel free to post them in the comment section for this video as well, and we will try to answer those. We'll have a little bit of time for some Q&A at the end here as well, if you guys have any further questions, comments, or concerns. But I also want to just reiterate how tonight's presentation is really all about you guys. This is not about me, but I really feel like there's a lot that chiropractic can offer people who are experiencing myasthenia gravis, people who are living an MG lifestyle. And so a lot of that has to do with how you live, how you sleep, how you move, and when you do your different daily activities that can affect your energy, that can affect your muscle contraction, that can affect your bowel function. So I'm sure a lot of you know a lot about that. Once again, I do want to just point out that we are thanking, let's see if I can do this right. I do it wrong every time. Somehow I can point to the the image here, the Myasthenia Gravis Foundation of Michigan. We want to thank them a whole lot for sponsoring tonight's presentation. So looks like we got some people tuning in here, which is great. And because this is a live broadcast and everything, you guys will be able to go back and watch everything as well. But also, please feel free to reach out to me personally. I'll get, once again, Dr. Kyle Wallner. I'm on Facebook. I'm very reachable, especially right now with all of our coronavirus circumstances and things of that nature. And, I was just thinking, what a perfect, example of living in Michigan today. I got my window right over here where it's snowing. Not sure if it was snowing where you're at, if you're on the west side of the state, but it was definitely snowing over here at different points during the day, at multiple different points during the day. But actually right now it's a beautiful sunny evening here. So we are thankful for that. So tell you what, I'm going to go ahead and get rid of the graphic here. We're going to switch screens to more of a presentation mode. So I hope you guys can see and appreciate that. And once again, I just want to say thank you to Alicia Hake and everyone over at the Myasthenia Gravis Foundation of Michigan, the board of directors, all of the leadership. Thank you so much for making this presentation tonight possible. And we just want to really thank you guys for that. So I think everything here is going well with our technology. So we'll go ahead and get right into it here, guys. So once again, my name is Dr. Kyle Wallner. I am a chiropractor here in Canton, Michigan. I'm also a wellness lifestyle coach. And I really specialize in just helping people live a healthier lifestyle, live an elevated experience of their neurology, their digestion, their spinal health. And that is just a little bit about me there. And once again, our practice is over here in Canton, Michigan. Feel free to give us a call or text 335-0533, area code 734, if you guys have any questions, comments, or concerns. And once again, we do just specialize in artful spinal chiropractic care over here on this right side. I think you guys can see my mouse there actually. So we're doing adjustments for people as a chiropractor. That's our primary service. And then we also work with functional medicine or nutritional medicine to really help people beyond just the structural chiropractic care. So not only are we adjusting the spine, but we are also working with nutritional medicines to really help people fuel their bodies so that they can thrive and express their genetics even better. So that's a little bit about the clinic there, a little bit about my background. And I'll also say too, one thing that kind of gives me a little bit of an insight into myasthenia gravis was during our clinicals down in graduate school a couple years ago. I was actually a participant in a program that was working with paraplegics. It was a clinic called Paraquad down in St. Louis, Missouri. And we worked with a lot of people that had multiple sclerosis, a lot of neurologic disorders, myasthenia gravis, and we're implementing these palliative care therapies because, again, we're not trying to, well, we are trying to provide a cure or to figure out a cure through research for MG, but we're not quite there yet. So that's what this presentation is going to be about, is a lot of these lifestyle things, these dietary things, nutritional techniques that you can implement and you can do to live a healthier lifestyle with that experience of MG. So that's what we're all about here at the Wellness Clinic. And just a disclaimer here, once again, I am a chiropractor, so I would assume that if you've been diagnosed with MG that you are under proper medical care and proper medical attention. And if you are not, that would be the first recommendation that I would have for you. So just a short disclaimer here, definitely touch base with your prescribing physician, with your diagnosing physician, whoever diagnosed you with myasthenia gravis, or perhaps you're on this webinar or on this broadcast and you're trying to gain more information for a friend who has, or a family member who has MG, and you're trying to help them. So please understand the scope of what we're talking about here tonight is going to be in conjunction with your medical provider and who's ever formally taking care of you from that medical perspective. So I just want to make a quick point about that there. So, okay, we'll tell you what. So here we are, and just let me make sure that everything is going well there. Awesome. So let's see. There we go. That's what I wanted to see. Okay. So here we are talking about myasthenia gravis, which most of you may or may not know. Again, I'm going to try to speak broadly here because I know some of you are diagnosed with MG and you know all about it, but some of you may not know all about it. Some of you may be on here, like I said earlier, trying to gain more information about a family member or a friend to help them out. So let's just start from the very, very top. So MG, or myasthenia gravis, it's a Latin expression which stands for grave muscle weakness, okay? And so this is a kind of disorder that gets into an area called autoimmunity or autoimmune disease, okay? And essentially what happens is this autoimmune condition affects the skeletal muscles. We'll talk more about that later because there's lots of muscles in the body that are not necessarily skeletal, okay? So that clinical pearl or that point is very important. And this condition also tends to often affect the extraocular muscles. So if you happen to look at someone's face and they have a drooping eyelid, or if they're having double vision, ptosis and diplopia respectively, those are two manifestations of MG that are very, very common for a lot of people, okay? People with MG wake up feeling fine. So they're often, they wake up in the morning just like anyone else and they're feeling typically okay, but usually get progressively weaker as the day goes on. So weakness in terms of their muscular weakness, okay? And if they're doing repetitive movements, that's often characteristic of bringing about that weakness there as well. And I'll also say this, guys, everyone's experience of MG is going to be a little bit different. So I'm really trying to speak about the broad generalization. So maybe you're waking up and you're exhausted, or maybe you don't have the double vision or the ptosis or the drooping eyelids. So, I mean, that's okay. But typically this is what we know about MG, and I'm just going to kind of speak with those broad strokes for the sake of generalities here. The demographic, or this preferentially affects young women and older men. Why? We don't really know, but it's usually being diagnosed with women in their 20s to 30s and older men in their 60s to 70s. So, but the big point that I want to really drive home here is this whole idea of acetylcholine. So acetylcholine is one of the body's 4 main neurotransmitters. I say 4 because that's usually what we talk about in the functional medicine world. There are other neurotransmitters, of course, but a lot of people have heard of serotonin. A lot of people have heard of dopamine. A lot of people maybe even heard of GABA, which comes from the spine, actually. When you do those spinal adjustments, is that release of that neurotransmitter called GABA. But the 4th neurotransmitter, one of my personal favorites, is called acetylcholine. So it's basically the word choline and then put an acetyl in front of that and you get acetylcholine. So I like to break things down and make things as simple to understand as possible. So this is all about acetylcholine. So if you get one thing out of our presentation for tonight, this is the thing I want you to drive home with is, how do I improve my acetylcholine function? Okay. Now we'll get to that here in a bit, but that's kind of the big deal here is the acetylcholine, the synthesis of the acetylcholine, the amount of acetylcholine in the synaptic cleft, and how it binds to the receptors, and how we can facilitate really good functioning between the neuron and the skeletal muscle cell. I'm getting ahead of myself, so let me stick to the slides. All right. So tell you what, let's kind of move forward here. So I'm about to jump into a broad overview of the physiology of MG. Okay, now I'm getting a lot of this from a great YouTube video that you guys can go check out yourselves as well. So if you go to YouTube, as you can see here, you start with YouTube. If you type in osmosis, there should be a channel that comes up with the name osmosis. I think you guys can see my mouse here. And then if you go to Myasthenia Gravis, so you're searching for the MG video in the osmosis channel, check it out. It's fantastic. But let's go ahead and break that down a little bit here. Okay. There we go. And so here is your normal skeletal muscle cell over here on the left, all right? And then what happens is we're not just talking about broadly the skeletal muscle cell. We're talking about like inside the skeletal muscle cell under normal circumstances, like for a normal person, if you will, who does not have MG, okay? So normal muscle contraction looks like this. So over here on the right, we have the cell or the inside of the muscle cell, okay? And then that is basically the inside of the skeletal muscle over here, okay? So what we have going on is we have our motor neuron, okay, at the top in yellow, and we have our muscle cell bottom in red here, all right? And that motor neuron is gonna release that neurotransmitter that we just talked about called acetylcholine, okay? Now that acetylcholine is gonna bind to these little purple guys down here, which are called, it's a big fancy term, it's basically the receptor. It's called the nicotinic acetylcholine receptor. So you got your acetylcholine up top, you got your receptor on bottom, and the one goes down to the other, and you get muscle contraction. Okay, so right down there at the bottom, muscle contraction. So if you take your arm out to the side and you were to bend your elbow, okay, like get a nice good bicep flex there. So that is muscle contraction using acetylcholine, okay? I know pretty basic stuff here, but this is how it works, and this is what really sets the stage for people who have MG. So we continue. All right, so on this slide now, this is what happens with someone who is experiencing MG neurology or myasthenia gravis neurology, okay? So what you have is this guy over here is a B cell, okay? It's part of your immune system. It's one of the cells from your immune system. It actually comes from your thymus. So we'll talk a little bit about, well, let's just talk about it right now. So for those of you who might know your thyroid gland, so who can tell me where their thyroid gland is, okay? So I think a lot of people know about the thyroid gland, but the thyroid gland, let's point to it, okay? So if you know where your thyroid is, go ahead and point to it. It's right in the middle of your throat, really, okay? So go ahead and just touch your thyroid. You can kind of move it around. It's kind of fleshy, okay? So you got 2 lobes of your thyroid. So that's your thyroid, okay? I think a commonly mistaken gland that people may not know about or may confuse with their thyroid is called the thymus. Okay, now the thymus gland is part of your immune system, and the thymus gland is pretty much right underneath your sternum, like your lower breastbone or your lower sternum. So if you can take your hands, you can kind of find your chest bone there, your sternum, your breastbone, you can touch that. Your thymus is going to be like right on the inside, right below, kind of in between your right and left lungs there is going to be your thymus gland, okay? And so we'll talk more about the thymus gland later, but basically these cells here, these B cells, are going to be coming from the thymus there. And what they're going to actually do is start to release, and we don't know why, they're going to start to release antibodies, okay? And so these antibodies are actually going to go and bind onto those receptors that we talked about earlier. So rather than the acetylcholine binding to those receptors, you've got these antibodies which are taking up the space and blocking those binding sites for the acetylcholine, okay? So what this all means is down here on the bottom right is that we no longer have that nice muscle contraction. So if my antibodies are taking up the place of my acetylcholine receptors, then I cannot bend my elbow. It's just not going to happen. Or I can't swallow, or I can't have my eyelid open, or any number of other manifestations. So I hope that makes sense there for you guys. Continuing on. So down here on the bottom left, these antibodies also activate what's called the classical complement pathway, which is basically a fancy term for a cascade of enzymes, okay? So this cascade of enzymes is purposefully designed to fight off bacterial infection, okay? And it intentionally, again, by design, it causes inflammation, okay? So because of this inflammation, you consequently get muscle cell destruction, which is over here on the top, on the middle right here, this muscle cell destruction. This also means, as you can see, there's a lot less receptors as there was previously, okay? So we get muscle cell. So not only we don't have the muscle contraction, but we also get a muscle cell destruction, and we get a downregulation or a reduction of the amount of acetylcholine receptors on the surface of the muscle cells. So like my good friend says, this is just no bueno, okay? So to add insult to injury, if you will, in some people, a minority of people with MG produce another type of antibodies called muscle-specific receptor tyrosine kinase antibodies. So again, not so much important the name of the fancy names here, the scientific names, but what does this mean? So these antibodies actually target proteins inside the muscle cell, okay? So again, not only are we getting a lack of that contraction, but we're also getting muscle cell destruction here, okay, via two different pathways, okay? So again, this is just not a good situation, you know, and if that wasn't enough, MG or myasthenia gravis is also commonly or not so commonly part of what's called a paraneoplastic syndrome. So there may be an underlying condition that is causing or part of someone's experience of MG. So for example, lung cancer or bronchogenic carcinoma could lead to an expression of MG. Same thing with a thymic neoplasm or a growth on your thyroid. So and that actually leads us into a little bit of a discussion on that thymus gland, which we'll talk about here in a second. But I would be remiss if I did not at least mention that you can have what's called a myasthenic crisis. Okay. Now, if the MG or this reaction, this autoimmune reaction, is only affecting your skeletal muscles here and it's not really affecting your thyroid, then you can basically live. You can manage. You can have palliative care. You can do lots of different things. There's medication. There's lots of different things, and you just kind of live an MG lifestyle. However, if the expression of MG starts to really affect your muscles of respiration, let's say your diaphragm, then you can have difficulty breathing, and that can be a life-threatening condition. So I also put a thing in here about the heart muscle. So yes, the heart is a muscle, and so are your muscles that contract for your colon and your gastrointestinal system. Now, typically, and again, everyone has a different experience or expression with MG, but typically the MG is only going to affect, or this autoimmune reaction is only going to affect those skeletal muscles. So like you don't have to worry about your heart or your gut muscles, your GI muscles, because they're involuntary. And MG is typically only affecting the voluntary muscles. Okay, so to review, once again, you've got MG here with antibodies that target that favorite neurotransmitter, that awesome neurotransmitter, acetylcholine. And there's two main things that happen here. You've got a blocking of the receptors from those antibodies that block receptors, which leads to no contraction. And then you've got those, the complement pathway is also activated, which leads to muscle cell destruction. So that's the main things we're concerned about, is an inability to contract the skeletal muscles and the destruction of those muscles themselves. It typically affects a lot of young women and older men, classically speaking, and then it's also going to affect the extraocular muscles. So you're going to see that ptosis, that eyelid drooping, and that diplopia, or what's called double vision. So that's kind of like a good overview of what we just went over. So, okay. Now, the clinical goals. So when we get someone in the office that has MG, or if we're trying to help someone out who has MG remotely, so it basically comes down to two main things here. So as you can see, number one is going to be that reduction of, or reduce the amount of antibodies. So let's kind of talk through that here. Okay, so if we can reduce the number of antibodies that are affecting, or that are going towards those receptors, then that's going to be a good clinical goal there. Okay. So one way of doing that is by what's called a thymectomy, or like removing that thymus gland that we talked about earlier. That's right behind your sternum there. Okay. So if by removing that thymus gland, what they've found is that you've got less antibody production, which means the acetylcholine can bind to those receptors and the person can contract their muscles a lot better. So that's the first thing. Two other things that involve basically hooking you up to some blood lines there, if you will, to actually go into your blood. They can do what's called plasmapheresis, which is they're actually taking out the bad antibodies. They're removing the abnormal antibodies from the blood, or the opposite of that, which is called IV immunoglobulin therapy, which is they're going to put in normal antibodies. More about that later, because I've got a great solution for that as well. And this is often done with plasma. So this also brings up a very interesting point. Plasma. Okay, so not blood, but plasma. And it's awesome to see more people jumping on here. Thanks for joining us, guys. If you've ever donated blood, okay, if a lot of people have like an O blood type, but actually people that have AB blood, their blood is not very useful, because if someone has AB blood, they can't really give their blood to anyone else unless that person has AB blood type. So if you guys are watching with us here and you happen to know your blood type and you want to kind of share and build community here, go ahead and let us know what your blood type is, because that's always a fun question to ask people. You can drop that in the comments there. My blood type is actually AB positive, because I'm such a positive person. But one of the things that the Red Cross loves me for is actually not my blood, but my plasma, because my plasma would actually be useful in someone that has MG, for example, because they would want to put my plasma into that person's system for those antibodies that can do this therapy here, the IV immunoglobulin therapy. Okay. And then the last one I had here is just really trying to decrease your stress levels. Super, super, super important. And that's going to be a major clinical goal there, because stress will literally erode and deconstruct your body from the inside out. So that's all about that first clinical goal, which is reducing the amount of antibodies. Awesome. Sounds like we got some O negative people in the house. Great. So you guys are very common. You guys can probably donate and accept, pretty easily. Like I said, me personally, I've got to, if I'm going to give my blood away, I've got to basically be giving it to someone that has AB blood. But I am what's called the universal acceptor. So if I ever need blood, God forbid, they can basically just, close their eyes and pull one off the shelf and they can put it in me and I should be fine. So let's talk about number 2 here. So number 2 says increase the amount of acetylcholine. So again, this whole thing, if you get one thing out of this whole presentation, it's all about what can you do to improve your acetylcholine function. Okay, so that comes down to lifestyle changes. Oh, hit the wrong thing. Lifestyle changes, movement, very important, especially trying to time that movement when you feel most energized. Nutritional. Okay, so let's talk about some nutritional things. Choline. All right, so acetylcholine. That choline is going to be very, very, very important for your body to help make its own acetylcholine. So where do you get acetylcholine? Well, that choline is from fats. Okay, maybe some of you are good with your words, your etiology. If you are familiar with choline or cholecystitis, it's actually part of the gallbladder, part of your fats. Okay, so you don't want to eat too many fats because that can really mess with your experience of diarrhea due to what a medication that you're probably taking, which we'll talk about here in a second. A lot of MG people are taking an anticholinergic medication. So if you're consuming high amounts of fats, to improve your choline levels, you may have some increased diarrhea there. However, I would highly recommend the consumption or eating eggs, especially the egg yolks there. That's a great source of choline, and that's going to help your body make its own acetylcholine. Okay. Environment, temperature control. So for a lot of people, the heat, this is not so much a problem in Michigan right now, but a lot of times the heat will adversely affect someone's energy levels or their ability to contract their muscles, to swallow, those things like that. So controlling your environment is really important. Sleep is phenomenally important for the MG lifestyle. Really, really important to get adequate amounts of sleep for your immune system to downregulate antibodies, to recharge your acetylcholine levels, to rest your muscles. Very, very, very important. I'm always asking my patients 3 things. How are you sleeping? How are you digesting? And are you moving your bowels? Those 3 things. Parasympathetic nervous system, we'll talk about that here in a second with the spine. Sleeping is very important. For good sleep is imperative for the MG individual. And then we'll talk about some nutritional supplementation things here as well. So let's go ahead and get back to the thing here. All right, so let's talk about more of these. You know what? I want to go back 1 second. I just want to make sure I mention this too. I want you guys to make sure that you definitely do the traditional medical therapies, okay? Like the thymectomy, your acetylcholine medication, and then your day-to-day, but for example, like I was saying earlier, my office specializes in the day-to-day experience of people, helping them live a more palliative, elevated lifestyle to increase your energy, your productivity, and everything else you can do to live a really comfortable lifestyle with MG. Okay, so until we find a cure for MG, this is where we're at in terms of just really making sure that we can live as normal and as healthy as possible. And great. Just want to make sure I got that in. It's really important that you follow your medical doctor's recommendations first. Then do all these fun lifestyle, awesome things here. So let's talk more about treatment. So like we had mentioned earlier, the top medications, as you can see up here in the top right, are those acetylcholine esterase inhibitors. So whenever you see esterase, that's going to mean an enzyme. Okay, so these medications are inhibiting an enzyme that breaks down acetylcholine. So you might have heard the pharmaceutical medications neostigmine or pyridostigmine. Okay, so right here in the neurosynaptic cleft, you've got that release of that acetylcholine. All right, so those medications are actually blocking an enzyme which is breaking down the acetylcholine. So long story short, those medications are trying to increase the amount of acetylcholine that's in the cleft there, so more of it can bind to the receptor. Okay, I hope that makes sense. So the whole idea here is to improve the muscle contraction. Okay, so like it says here, it looks like people are trying to think of their blood type. So it's been a while, so totally understand. If you go to the Red, I know if you do this, if you go to the Red Cross, if you donate, the card that they give you does tell you your blood type. I have my card here in my wallet. That's how I found out my blood type, things like that. So again, the whole purpose of those medications are to increase the concentration of acetylcholine. Okay. Now, immunosuppressive medications like prednisone the purpose of those is to try to reduce the production of antibodies. Okay, so if you're producing less of the antibodies that are supposed to be or not supposed to be taking up those receptor sites, then your acetylcholine is going to have more of a chance to get on those receptor sites and cause muscle contraction. Here's the thing: long-term use of prednisone is going to lead to bone thinning. So depending on your age, that could be a really important thing to consider or to contemplate there is, do I want my bone density to go way down and cause bone thinning due to the immunosuppressive drugs or the prednisone, okay? The other thing we talk about here is the surgical removal of the thymus, which we talked about earlier, reduces the muscle weakness. Again, we really don't know a whole lot about why this works, but it does seem to basically downregulate or reduce the amount of antibodies there that's causing havoc on someone's skeletal muscle cells. So moving further along here, and this is just a quick thing. I was looking some things up from Henry Ford. So there's lots of really good medical treatments here for the MG lifestyle and helping people out with their comfort there with MG. So all of this to say, how does this relate? So Doc, you've been talking a lot about the physiology of MG. You've been talking a lot about the medical approach to MG. So how does this relate to chiropractic? Well, let's get into that here for a few moments. So I think you guys can see my awesome spine here, but the whole idea is with chiropractic, we're really trying to help the brain up here, okay, communicate with the rest of the body down here. So if you can follow along with my cursor here, I think, you've got your brain up here, and then you've got your spinal cord down here. And that is the main method of communication to the entire rest of your body, okay? And so the nervous system, okay, because that's what acetylcholine is working with. It comes from your nervous system. It's the primary system. It is the number one system, okay? If someone, God forbid, has a heart attack or can't breathe, or if they need a blood transfusion, the medical model, we can give them a heart transplant. We can put them on dialysis, the kidneys. We can even put them on respirators and ventilators. Like, we can basically keep someone alive, albeit it's not, necessarily the best life possible, but we can keep someone alive if their circulatory systems or their respiratory systems fail, okay? That is not the case with someone's nervous system. We can't keep someone alive if their nervous system just goes, okay? So we don't have a spine transplant, and I'm not sure if we ever will. But, we can do like a heart transplant. We can keep you alive. We can pump your blood for you, things like that. But we cannot actually give someone a new spine or a new central nervous system, a new brain, things like that. So the whole idea here is that chiropractic is, or the structural adjusting of the spine so that your brain can better communicate with your body, is the number one way to influence your entire nervous system, so that, like I said, so that your brain can better communicate with your body and with your peripheral nervous system, okay? So that's the whole idea here. As you can see, the nerves that go to all of the organs, muscles, glands, tissues of the body ultimately come back to this central canal that goes right from the top of your head all the way down to the bottom of your pelvis here, which is your spinal system. And the number one way to affect that system is by removing the nervous interference or the structural interference that comes from having subluxations or the chiropractic lesion in your spine. And so the thing that I love about this is it's non-surgical and it is non-pharmaceutical. So we are not giving you a medication and we are not cutting you open, but we are profoundly affecting your brain and your body through this natural way of healing. And another reason why I'm so passionate about this is because this is not so much someone doing something to you. This is truly a form of empowerment. This is you healing yourself. And I think for a lot of people, sometimes we just need a little bit of help getting out of our own way. And so that's where your chiropractor comes in. Your chiropractor just helps you get out of your own way, because here's the truth: your body knows exactly how to heal itself. And so by just helping that person get out of their own way, essentially, or by removing the interference or reestablishing the communication, you help that person heal themselves. So let's dive into some research. Let's just not, this is all anecdotal, right? This is just, oh, doc, you're just a chiropractor, you're super biased, so what does the actual white paper say? What does the research say? Well, here we go. We have a, for those of you who know, PubMed is the primary research vehicle for the scientific community. And here we have the chiropractic management of a patient with MG and vertebral subluxation. So I want to go through about 3 case studies here with you guys. Unfortunately, we don't have clinical trials that really kind of compare MG, people that have MG and do like a trial of chiropractic care and compare their outcomes with, for example, the neostigmine or the pyridostigmine. There's that research doesn't exist right now. However, we do have really good case studies where people have experienced MG and they've gone in for chiropractic care and they've had tremendous results. So I want to articulate 3 of those examples here for you. So basically what we have here is an individual. This is a 63-year-old male who was suffering from complaints associated with the MG experiences. And it goes on to say how this person has swelling of the tongue, weakness in the eyes, difficulty breathing, all of the eye things we talked about, headaches, balance and coordination, walking difficulties. So this was their outcome. And I want to share this with you here. If I can magnify or expand the results here. So basically what this says is high velocity, low amplitude adjustments, basically your standard adjustment, was applied to the site of patient subluxation or where they needed their adjustment. And now MG is no longer debilitating to the patient. This individual is medication free and has resumed a normal life. And so I thought that was tremendous in terms of outcomes. Again, this is from, just to give you guys more context, this is from, I got so many windows here on my screen. This is from the Journal of Manipulative Physiotherapy from 1999, okay? So a little bit dated, but a very respectable journal. And like I said, this is just a clinical case study here. And I want to go ahead and share another one with you here as well. But the main point is, check it out. This patient had chiropractic care and now he is medication free and has resumed a normal life. I mean, that's huge. If you yourself or if your family member or your friend could experience a medication-free lifestyle with no longer having MG symptoms, I think that'd be huge. All right. So now here we have, and this is from the case reports from 2019. Okay, remission of myasthenia gravis following a cervical adjustment here. So what we have here is, I'm just trying to make sure I get the right screens here at the right time. What we have here is a 51-year-old female who had been diagnosed with MG based on symptoms and continued antibody testing. The patient's medication was halted due to the side effects. So that's another consideration there is a lot of these medications will have adverse side effects. The article goes on to say that this case was interesting because, so let's see here. I can expand this. Here we go. So let's see. Her back pain and MG symptoms went into complete remission within 1 month of initiating chiropractic adjustments. The concomitant recession of the myasthenic symptoms raises considerable interest for the mystery of MG, including the causal link between stress and autoimmune regulation and the possible mechanisms of disease amelioration. So once again, guys, before we go into our 3rd example here, I do not want to misspeak or say that everyone's going to have this miracle experience if they have MG, they're going to go to the chiropractor and be healed. I'm not saying that. However, I can definitely say that this is going to be something that's going to be tremendous for your lifestyle, for palliative care, for helping you to live with much less symptoms, a reduction of symptoms by going to a chiropractor, by getting regular chiropractic care, and implementing some of the nutritional things that we'll talk about here in a moment. So bear with me. One more example here. This is actually a pediatric case. This is from, again, Journal of Manipulative Physiotherapy from the summer of 2003. Here we have a 2-year-old girl was provided chiropractic care at the request of her parents for complaints of ptosis, which is that drooping eyelid, and generalized muscle weakness. especially in the lower extremities. So that's the thing. MG can affect really young people as well, even as young as 2 years old, babies, infants. I've even seen some things about pregnancy and myasthenia gravis. So here's the thing. Prior to entry into chiropractic care, magnetic resonance imaging, MRI, of the brain and the acetylcholine receptor antibody tests were performed with negative results. However, they did determine it was MG through the Tensilon test, positive diagnosis. So she has MG. So here's the thing. I want to expand this for you here as well. The patient was cared for with contact-specific, high-velocity, low-amplitude adjustments to the sites of vertebral subluxation complexes. So again, exactly where this patient, this 2-year-old girl, needed their adjustments in the upper cervical and sacral spine. So in the top part of the neck and the bottom part of the low back there, right in between the pelvis. So here's the thing. The patient's response to care was positive, and after 5 months of regular chiropractic treatment, her symptoms abated completely. So her symptoms abated completely after 5 months of regular care. So here's the thing, guys. What have you got to lose? Chiropractic adjustments, they're not going to make you worse. If anything, they're going to make you feel better. They're going to help you live a healthier life. They're going to help you have less symptoms. And I just don't see a downside into if someone does have MG and they're looking to live a healthier lifestyle, if they're looking to live with less expression of their MG, then definitely consider chiropractic care significantly, because I think it can make such a significant difference. So once again, just in summary, if you are living with MG, I highly recommend chiropractic care. As you can see, here's a photo of us doing some adjustments here at the office. Spinal adjustments can help you decrease your stress, improve your energy, increase your energy, improve your balance and coordination, increase control over your chewing and your swallowing functions, improved attention and focus, and helping you to sleep better, enhance digestion, decreased pain and stiffness, and even muscle soreness. So let's go ahead and okay, so quick question, context-specific, high-velocity, low-amplitude adjustments, going back to our research there, that is just a fancy way of saying your standard hands-on manual adjustment to the spine. That's just the scientific talk for it in terms of putting the hands on the spine and doing those adjustments versus, say, like using an instrument like an activator or another instrument there. So let's see. Okay. So it looks like we're doing some good information here. Again, if you guys have some questions or some comments, please feel free to reach out. Let's kind of move forward again. So again, all those benefits there from chiropractic care for the patient living an MG lifestyle. I want to briefly talk about the vagus nerve, okay? So if you guys have ever heard of the vagus nerve, this is really, really, really important. The vagus nerve is going to come out of the top of your neck there, the bottom of your head, top of your neck. It's one of the 12 cranial nerves. It is cranial nerve number 10. And so just like a skeletal muscle, just in the same way that you can exercise a skeletal muscle, you can also exercise your vagus nerve. Okay, so there's points here in the ear that you can activate that can actually stimulate your vagus nerve. So if you can see my mouse here, it's going to be right on the yellow part there, which is that like inside canal, if you will. So people will often stimulate their ear that way to stimulate their vagus nerve. But the whole point of the vagus nerve here is that it goes down and it is responsible for your entire parasympathetic nervous system. And this can play a major role in your stress levels. And if you want to decrease your antibody levels, if you want to improve your digestion, if you want to decrease your stress, doing these things we're talking about over here, humming, like deep throat humming for extended periods of time, like to your favorite song, gargling with a glass of water. Okay, so this is really important too. You have your glass of water, you take a drink, and you gargle with that glass of water, or with that gulp of water there. And then you need to gargle intensely. Okay, this is not just like one gargle and then spit it out in the sink. This is like gargle intensely with that mouthful of water, spit that out, and then take another gulp of water and do that for the entire glass of water. Okay, so very, very important to really be intentional about the gargling there to fire that vagus nerve. The gag reflex, if you take a spoon or something, put it on the back of your tongue to gag yourself, that initiation of that gag reflex is going to fire that vagus nerve really well also. We talked about the points in the ear, and then of course chiropractic adjustments are going to be phenomenal for improving your vagal tone and firing that vagus nerve. Okay, so let's continue on with that. Like we talked about, humming, gargling, gag reflex, chiropractic adjustments, restoring oral peripheral tolerance. That might be a subject for another talk. Don't have time to go into that, but I do want to go into some nutritional things. So here are Dr. Kyle's top 7 recommendations for acetylcholine, or abbreviated ACH health. Okay, so I've got 7 things I want to recommend here for the person that's living with MG. And these are going to be really targeted towards improving the health, the function, the synthesis of your acetylcholine. So let's go through those 7 things here. And let's talk a little bit about a great solution here. This is called Acetyl CH Active. This is a nutritional medicine. So I got 7 nutritional medicines here for you. The first one, I would argue the first 2 are probably going to be the most important, which are going to directly influence acetylcholine function. Okay, I could do probably a whole 2 hours about this one thing here, but this is so important for your acetylcholine function. The formula here, there is an ingredient called huperzine. Okay, and huperzine, Huperzine. Huperzine is going to specifically modulate and improve the biosynthesis of acetylcholine. Okay, you've also got some amino acids in here. You've got some good alpha GCP, some precursors to glutathione, N-acetylcysteine, things of that nature. But this is a very clean formula. I use this with a lot of our patients who are having trouble with brain fog, with their memory, with just cognitive function in general. And here's the great thing, guys, about acetylcholine function. You are not going to overdo it like you will with the other neurotransmitters. Okay, so when you think about serotonin and you think about someone who's on an SSRI, or maybe you know people who are on SSRIs, maybe you're taking an SSRI yourself, or a selective serotonin reuptake inhibitor. The longer you take that SSRI, or the longer you're on the Prozac or the Zoloft, over time your body becomes sensitized to that medication. So it's almost like any other addictive context where your body needs to have it in order to function normally. That is not the case with acetylcholine. So what I'm saying is, you're not going to develop a dependency upon something like this in the same way that someone could develop a dependency with like an SSRI or a benzodiazepine or a D2 blocker, if that makes sense. So what I'm saying is, acetylcholine is unique among the neurotransmitters. The fancy term for it is called homotrophic modulation. So Google that term. I could probably talk for an hour about homotrophic modulation alone. But this is very, very, very good for the person that has MG, is this Acetyl CH Active nutritional medicine right here. I'm pretty sure that's the main thing I wanted to talk about that. Now, here is a spray delivery of some of those same formulas for a faster acting solution. I like the spray deliveries because, 1, they're convenient. 2, they're portable. You can throw them in your bag, your purse, something like that. 3, they're great for kids, like we talked about that pediatric patient, or kids, people that have trouble swallowing capsules. The sprays, the liquids are phenomenal. Also, they bypass your gut digestion, okay? So the liquids are absorbed sublingually into your bloodstream, and they act fast, like they're working right away, okay? So in here you have that NAC, that N-acetyl L-carnitine, the alpha GCP, and then that really good vitamin B6, which all support your body's own pathways to produce your own acetylcholine. So like I said, if you guys were to only do 2 things here, I would highly recommend the Acetyl CH Active and using the Acetyl Flow. Those two together for the person that has MG who wants to experience a healthier lifestyle, reduction of symptoms, better sleep, everything we've talked about, these two things would be phenomenal along with their chiropractic adjustments. Now, number 3, this gets into the immune system. So this is awesome because this is the only, I think you guys can see my mouse here. This is the only nutritional medicine that's available that has what's called immunoglobulin or IgG concentrate on a clinical level. Okay, so like we talked about earlier, that IV immunoglobulin therapy, that's where they're like putting those immunoglobulins directly into your bloodstream with the lines there into your arm. So what this is a powder form of incredibly clean and quality immunoglobulins that you can take as a nutritional supplement. You can add this to your shake if you do like a protein shake in the morning, or if you use a protein shake to replace a meal for one of your days. But this is a dairy-free source of immunoglobulin as a dietary supplement. So again, I could probably do an entire hour about this as well. But I use this with our patients in our practice that have other autoimmune conditions. This is phenomenal, okay? Serum bovine immunoglobulins, fantastic. If you guys have questions about this, please feel free to reach out. I've got loads and loads of information about this. I actually did a podcast about this with Dr. Elroy Vojdani, which is on the Michigan Family Wellness Podcast. If you guys listen to podcasts, I'll mention it earlier, or I'll mention it later, but it is the Michigan Family Wellness Podcast on Apple Podcasts, Google Podcasts, and Spotify. And we do talk about this fantastic solution here to help people that have autoimmune conditions with serum immunoglobulins. Very, very, very important. Continuing on, if you guys have heard of turmeric, if you've used curcumin clinically or nutritionally, this is a brand new solution of turmeric that is designed to interact at the microbiome level. So this is not just curcumin, or this is not just one part of the turmeric root, but as you can see here, this is a full spectrum turmeric matrix that has been shown clinically to be even more effective at the microbiome level, rather than trying to shunt it into your bloodstream and then disperse it throughout your whole body. So I highly recommend this form of turmeric to be used as an incredible anti-inflammatory solution. So that is also available to you guys. I would be remiss if I did not recommend a really robust probiotic. So probiotics are phenomenal for your immune system, especially when it comes to making your own vitamins, your cognitive health. Most of your neurotransmitters are actually synthesized in your gut. So it's very, very, very important to have a robust, diverse blend of probiotics. So as you can see, really nice blend here as well. So that's a good probiotic there for you guys. And then we have a fantastic vitamin D recommendation. So vitamin D is basically name a system of the body, and you can probably find research that has been shown to suggest that vitamin D is going to be helpful for that system. So your cardiovascular system, your immune system, your cognitive mental health system, your emotional health, vitamin D, especially for those people that live in Michigan, like most of us, where we don't get a lot of sunlight, vitamin D, and especially when paired with, as you can see there, the formula, when paired with vitamin K2 as MK7, very, very, very important for your immune system health and to help down-regulate those amount of antibodies there that you're producing. So, and vitamin D is probably one of the easiest things to fix clinically. Like if you're doing your routine blood work with your medical doctor, like your annual blood test, and you happen to come up with low vitamin D, just simply take more vitamin D and it should come right up. It's really simple to correct. You want to see it around 100 on the blood test there. So very simple. Okay, and then finally, again, trying to dampen inflammation systemically in the body is going to be a fantastic fish oil or a fantastic omega fatty acids. I wanted to highlight how the difference between fish oils or omega fatty acids that are in the triglyceride form versus the ethyl ester form. So you want to make sure that you're consuming a triglyceride form of the fish oils there, of the omega fatty acids, because there is so much more effectiveness, 70% more absorption, better than the ethyl ester form. So if you're taking a fish oil, like a lot of people are, if you're taking the Costco omega fatty acids or, the Meyer, whatever, try and look on the bottle there. If it even says, a lot of them don't, but what you really want to be putting your money and resources towards are things that actually work. And that's why I'm going to recommend using a triglyceride omega fatty acid solution like the one you see here. Okay. And that pretty much rounds out our 7 recommendations there. And if you guys are interested in any of these recommendations, feel free to kind of rewind the video here, write them down, and you can navigate to our website down here. This is actually an online nutritional pharmacy. It's called FullScript. And, like, for example, that Ortho Omega here, if you're like, man, Dr. Kyle, he really kind of gave me some good clinical pearls about the importance of triglyceride form omega fatty acids. So you just kind of write that down, navigate to our clinic FullScript online nutritional pharmacy here, which is just found at us.fullscript.com/welcome/Dr. Kyle. So I'll just kind of pause here for a second. And if you guys just simply, all you do is you just punch in your email, and then you can access, you can look up those specific recommendations there that we just went over, including the Acetyl-CH Active and the Acetylflow, those first 2 we talked about. You should be able to find those inside this online dashboard. And this is a great platform because even though I'm over here in Canton, Michigan, you may not be in Canton, Michigan. This platform can send those to your front door or send those to you, no problem. And I do know that with every order over $50, they do free shipping. So it's a really, really good platform, really affordable prices, much better than Amazon even. I've had people tell me. It helps to support us at the clinic here. And I think you guys are going to really like this platform if you're interested at all in any of those nutritional medicine recommendations. So once again, FullScript, fullscript.com/welcome/Dr. Kyle. That's where you can find all of that. Like I mentioned earlier as well, we have the Michigan Family Wellness Podcast. If you guys are podcast listeners, you can find us on Spotify, Apple Podcasts, Google Podcasts. Definitely check out some of those recent episodes. Like I said, there's a great one on there where I talked with Dr. Elroy Vojdani about those immunoglobulins, those serum immunoglobulins. They're very, very good stuff. So if you guys are podcast listeners, you can definitely take the time to check that out. And I think what we'll do here for a minute is if we have any questions, comments, or concerns, please feel free to reach out, or, if they come in later from people who are kind of watching the replay here, you can go ahead and drop those into the comments section here below. I'm going to go ahead and try and get our MGMI photo back up here. Awesome. So yeah, we'll just kind of pause here for a moment. If anyone has any questions about MG, the lifestyle things we went over, how it relates to chiropractic care, please feel free to reach out and let us know about that. Let me just check my mobile device here for a moment. So question here. High risk of stroke after chiropractic adjustment. Okay, why does that happen? Can that happen with any adjustment? Okay, yeah. So the basically what this comes down to are some people are concerned about getting their neck adjusted from their chiropractor because they're concerned about having a stroke. And I can tell you that the research about stroke as it relates to chiropractic says that you are actually just as likely to get a stroke from going to see your medical doctor as you are from your chiropractor. So the research says that the stroke itself is already happening for the few people that have actually had a stroke around when they saw their chiropractor. They have found that they're actually already having the biologic processes of the stroke, and they just happen to go to their chiropractor. Okay. So there really isn't a connection between vertebral artery dissection is what it's called, and chiropractic adjustment. it's like you really have to be trying so hard or have to be like intentionally trying to kill someone for that kind of thing to happen. Like you see in martial arts, they do like the neck rip or whatever and people die. Well, sure. But when you go to your chiropractor, your Michigan state licensed chiropractor, that's just not going to happen. It's just not even a concern. And like I said, the research actually says that you're just as likely to have a stroke when you go to your medical doctor's office. So there really is no major concern there. If you guys want, clinical white paper research on that, I can provide that to you as well to back up what I'm saying, because that's basically what the research said, is that there's really no major concerns. Okay, and yes, always talk to your physician before starting new supplements. Very, very important. So don't just take my word for it. Take these recommendations, go to your medical provider and say, hey doc, what do you think about these? I heard this chiropractor talking about them. I want to know what you think and if I'm clear to take these. So very good, important point there. Looks like some people had some trouble refreshing the page, which is totally fine. But hey guys, that is mainly it for today's presentation of chiropractic and what you need to know as it relates to myasthenia gravis and the MG lifestyle. Once again, I want to thank the MGMI, the MG Foundation of Michigan, for sponsoring tonight's presentation, and also Alicia Haig for making this presentation possible. If you guys have any questions, comments, or concerns, please feel free to punch those into the comment section below this video or send me a direct message. We'd love to help you out there and support you as best as possible. So that'll basically do it for tonight. And I hope you guys are having an awesome week here, kind of all quarantined up inside. Absolutely, you guys are more than welcome. It's been awesome doing this for you and working together on this. So I hope you guys have a great evening, and we will talk to you soon.